Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Here's where I bring to you from the world of medicine. Regular salt use linked to 41% higher gastric cancer risk, study finds. In a recent study published in Gastric Cancer, researchers found that individuals who always add salt to food were at a higher risk for gastric cancer than individuals who rarely or never added salt. Gastric cancer, also known as stomach cancer, is the fifth most common cancer in the world. Many factors contribute to the risk for gastric cancer, including smoking, increased age, obesity, and family history. Previous studies have indicated that regular consumption of salt is associated with an increased risk of gastric cancer. The high sodium content in table salt has been linked to the development of gastric cancer due to its potential to damage the lining of stomach and promote inflammation. Excessive salt intake can lead to formation of carcinogenic compounds in the stomach, increasing the risk of cancerous growths. In the study, researchers utilized data from the UK Biobank, incorporating 471,144 participants in their analysis. These participants completed baseline questionnaires detailing their frequency of adding salt to food, excluding salt used during cooking. Additionally, researchers measured urinary sodium, creatinine, and potassium levels to estimate 24-hour urinary sodium excretion. For various such as physical activity level, age, alcohol use, red meat consumption, and fruits and vegetable intake were counted for the analysis. The median follow-up period with participants lasted 10.9 years.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possess in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
Plant-based diet provides various health benefits, study says. According to a study published in the journal PLOS One, vegetarian and vegan diets have been linked to improved cardiovascular health and reduced cancer risk, along with lower incidences of cardiovascular disease and cancer. Previous research has found a connection between specific dietary patterns and elevated risk of cardiovascular disease and cancer. Diets characterized by low intake of plant-based foods and high consumption of wheat, refined grain, sugar, and salt have been associated with increased mortality rates. To mitigate these risks, recommendations have been made to reduce the consumption of animal-derived products in favor of plant-based alternatives, with the aim of lowering the incidence of cardiovascular disease and cancer. Nevertheless, the comprehensive benefits of adopting such dietary changes remain uncertain. In the study, researchers conducted a comprehensive review of 48 papers published between January 2000 and June 2023. These papers had compiled evidence from various prior studies. Employing an umbrella review methodology, the researchers extracted and analyzed data from the 48 papers to investigate the association between plant-based diet, cardiovascular health, and cancer risk. Infertility treatment linked to risk of postpartum heart disease study. A study conducted by Rutgers health experts analyzing over 31 million hospital records indicated that individuals undergoing infertility treatment were twice as likely to be hospitalized for heart disease in the year following delivery compared to those who conceived naturally. The study published in the Journal of Internal Medicine found that patients who underwent infertility were particularly likely, that is 2.16 times as likely as those who conceived naturally, to undergo hospitalization for dangerously high blood pressure or hypertension. Cardiovascular disease is a major cause of maternal mortality, contributing to an increased number of maternal deaths over the year and now accounting for 26% of pregnancy-related deaths. Infertility treatment is becoming more prevalent as means to attain pregnancy, with approximately 12.2% of women of reproductive age seeking such services between 2015 and 2019. Assisted reproductive technology accounted for only about 2% of births in 2018. However, alongside its increasing use, infertility treatment has been associated with adverse outcomes for both mothers and newborns. These include heightened risk of hypertensive disorders of pregnancy and gestational diabetes. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.